Good evening, good evening, good evening, and welcome to Couch Conversations with the Doctors, where health is wealth. What night is it tonight? It is Monday night, and it is time for Couch Conversations with the Doctors. As always, we have our esteemed panel guest that's here, and I know you guys have really been asking, where has Dr. Mason been? There he is. He is back. I told you he had just been a little busy, but once he got free, he would definitely be back. So Dr. Mason is back with us on tonight, and we're going to start with Dr. Mason. Introduce yourself.
Oh, good. My name is Dr. Terry Mason. I am not born in Chicago, but I've lived in Chicago all the life I've known about, and also been totally educated from kindergarten all the way through medical school, surgery training, and all of that right here in Chicago, and practiced in Chicago as a board certified urologist, and also had the opportunity to serve in the capacities of Commissioner of Health of the City of Chicago and uh, the director for the Cook County Department of Public Health. I'm sorry, the Cook County Department of Public Health, as well as um, doing some other very interesting things, particularly as related to HIV and uh, sexually transmitted diseases, because we had some real issues dealing with that. So that, and I've been doing my radio show on WVON for over 25 years now, and I'm grateful for all of you who tune in on Sundays to hear it. And I'm looking forward to having a great conversation this evening with my esteemed colleague, Doug, and with the distinguished Congressman Danny Davis, and of course, the lady who makes it all happen and keeps it smooth and sailing, Miss Nikki.
Thank you so very much, Dr. Mason. Well, to my colleague who tends to leave us and have fun in the sun, now the snow is melting. It's still cold, Doug, but the snow is melting. So it's slushy, muddy, and ugly.
Well, I tell you, it's raining a lot here, so I'm not so far from the slush. I'm a retired physician. I spent all my professional life in Chicago, 30 years, then retired, and then spent 2 years with the congressman's office in Washington, D.C. And it really opened my eyes to public policy and public health. It's really an honor and a privilege to be here with Dr. Mason and the congressman, and we're going to try and answer questions as best we can.
Outstanding. And to the man who makes this possible for us each and every Monday night, to the one who teaches us that your real health, your real wealth is your health. That's our very own Congressman of the Illinois 7th Congressional District, Congressman Danny K. Davis. Congressman?
Well, thank you very much. I want to thank Dr. Graham and Dr. Mason for being with us this evening. It has been extremely cold, and I think it has caused individuals to have some upper respiratory difficulties. As a matter of fact, my legislative director and deputy chief of staff is out today with cold. I could be out, but I'm in with cold. And we've been trying to stay warm, but so many exciting things are going on and happening, especially with health centers. I've been working, and we've been working on a newsletter that the association is beginning to put out every month on the impact of federally qualified health centers in congressional districts. They've done the first one, and they've invited us to do the next one. And I think one of the reasons that they have invited us to do the next one is because they know that I'm going to be leaving at some point. And they also know that I've been around pretty much the whole time that these things have been going on. I actually started work in healthcare in 1969, 68, and ran something called the training program for the Martin Luther King Health Center. And I did that for a brief period of time. Then I left that and took a job as executive director of the Westside Health Planning Organization. Back at that time, health planning was taking place all over the country, funded by a federal program called the National Health Planning and Resources Development Act, which sunset in 1974, and they went out of business. So then I left there and went to work at Miles Square and worked there as the assistant to the president, who was a fellow named Dan Cantrell. Ultimately, Dan ended up being the district director. But this week, the association is having its 60th anniversary. And I remember being in the meeting when they decided to organize the association. And so I've been around pretty much since that time doing one thing or another. And I'm hoping that we don't have a vote at the time that the gala that they're having Wednesday is going to be taking place, because they are going to give me a Lifetime Achievement Award. And I'm also supposed to be the featured speaker. And so I'm hoping that the timing of all this comes out good. So thank you all so much, and why don't we get it going?
Sure thing. Want to say hey to Connie Taylor, who is here, and she says, good evening to everyone. Well, Doug, upper respiratory infections, as the
Hello.
Congressman talked about, upper respiratory issues. Why don't you kind of run that down for us? Is that asthma? Is that pneumonia? Is that bronchitis? Is it COPD, chronic pulmonary obstruction disease? What does it all fall in, and is it all tied together?
Well, they're kind of different aspects of how they affect the way oxygen comes in and out of your body. I mean, the lungs are a tissue like a sponge, and their big job is to take oxygen out of the air and get it into the blood, and then some of the other products out of the blood back to the lungs and get it out of your body. And so it's a combination of a sponge and then an intricate set of tubes of different sizes to get the air down to the very end of the lung and to get all the other gases out of the lung. So when you have bronchitis, that's when you have an infection of the tubes, starting with the neck all the way down the major tubes into the lungs. And when they get infected, they produce extra fluid, they're sore, they're irritated, they cause a cough, and that's usually from a virus. And that usually has kind of a relatively short period. Asthma is a little bit different. It's not necessarily of the big tubes, but the smaller tubes that are lined with muscle. And they often get irritated and go into spasm. And there's medications that you can take to keep them from spasm. But when they go into spasm, you cough a lot, and it's hard to get air in and out, so you kind of feel short of breath. Pneumonia is something a little bit different. That's when you actually have an infection of that sponge-like tissue at the very end of the tubes. And you can have it in one portion of the chest or 2 or 3 portions at the same time. That can be infectious. For instance, TB causes a pneumonia, and that's clearly an infection. It's been really kind of interesting during my career. We now have vaccinations for pneumonia and boosters for pneumonia because it's still a major cause of illness and death in our population despite having a great array of antibiotics. So I'm hoping that's a good start to answering some of the questions about that. That's one of the big reasons why people are so interested in vaccinations. Influenza causes a lot of bronchitis. It can proceed to a pneumonia because if those tubes get filled with fluid, it keeps the normal defense mechanisms from clearing things out of the lungs and getting them out of your body. And if they're trapped down there, they tend to grow and multiply and cause other infections. So getting a vaccination for influenza is a way from protecting you from getting a more serious infection in your chest and lungs, possibly pneumonia later on. So it's been really, really interesting for me to see during my career how many new vaccines they've had and how successful we have been in preventing serious illness and death because of these vaccinations. I'm hoping I've covered the 4 questions about, pneumonia, bronchitis, and asthma. COPD is different. COPD is a result of the damage to the lungs from inhaling products like lungs, but it also could be from like tobacco smoke or other toxic fumes, and it causes damage to the very fine tissues of the lungs. And as a result, they don't work very well, and they produce a lot of extra fluid and mucus. And so you're always coughing this up, and it's harder and harder to breathe. And if there's enough damage, it's hard for you to open and close your lungs and move the air in and out of your chest. So you always feel like you're short of breath. So Dr. Miller, I wonder if you could take more and talk a little bit more about asthma and COPD?
Sure. Well, asthma is probably one of those diseases that probably the community knows a lot about, but in terms of people that have the disease, but they may not know a lot about what the mechanism and what kinds of things that exacerbate asthma. But asthma is one of those diseases we call it's a disease of the lung, and it's a issue with bronchospasm. What that means is that the airways that we breathe in and out of becomes constricted because of abnormal responses to or responses to things that are in our environment. But the fact is that after a period of time, the lungs get damaged, and then our ability to compensate for that becomes less and less. Now, we often see a large problem. We see a big problem with asthma in children as well. And like I said, the problem is that the airway constricts. And so when the airway constricts, it's hard to get air in and out of the lung. And I don't know if you ever had the wind knocked out of you. It is a very, very unpleasant sensation. I played football when I was in high school, and several times I got the wind knocked out of me, and you feel impending doom. You feel as though that life is about to leave you. And so those are the types of sensation that you feel when you can't breathe. That's a very, very bad feeling. So when individuals with asthma have bronchospasm, the sensation is that they feel that I can't breathe, I can't catch my air, I can't blow the air out. They don't exactly know why the problem is. However, it is a devastating problem. Now, there is medication that does help to treat it. And usually it's the inhalant that gives us the quickest response in terms of getting some reversal of this process and making us feel somewhat better. Now, if there are underlying conditions, such as if you get an infection in your lung, I mean, even sometimes a virus like or a pneumonia or, those kinds of things can also additionally compromise the lung further, which means that you have less good lungs to work with. When you have something else occupying those air spaces, that means you have less functional lung to work with, and so that too will compromise our ability to breathe. And so, like I said, these are very, very difficult situations for people who are experiencing trouble to deal with, and they need to have treatment as soon as possible, because if you don't get, if this has become severe, then and your oxygen level fall below a certain level, then other kinds of complications set in. So when your oxygen levels fall below a certain level, it affects your heart, it affects other organ system in your body, which create other kinds of problems and can lead to cardiac arrest and ultimately death if not attended to quickly and appropriately.
Dr. Miller, I want to just add something to what you said and what's already been said by Doug. And that is a couple of things I'd like to go back to the beginning and talk about the thing called a cold. And we all use the term cold. We have a cold, but we don't really know what that really is just yet.
Yeah.
And we have different things about how you catch a cold. And then we have things about what we can do about the cold once we have it. But the other thing we have to think about is we don't always connect the things you just talked about with the cold, pneumonia, and all these things, so that we can give you a better breakdown of what does it mean, what a cold is, and does it being cold outside make you catch a cold? And what are those things that are responsible for catching the cold? And I'll leave that to you guys to just, I just wanted to throw it out there as a teaser because
go ahead, Doc.
I'm going to say that, we often associate that with cold weather, but that may be the season for colds. Colds are really viruses, and they're things that are in the air. They come in cycles and in seasons, and those are things that make your nose run and make you cough and make you produce extra fluid because your body's trying to get rid of that virus. Doesn't want it there, doesn't like it. It's got to get rid of it. But that's also something that can complicate asthma. If your airways are sensitive and they don't like to be irritated, a virus is a very irritating experience. And having all that extra irritation, that fluid, and that mucus can make it even harder for you to breathe. So that's why it's kind of very important to do that. Viruses are contagious. They're in the air when people cough. They're on surfaces, like when you go to the supermarket, you'll often see that they have like the wipes to wipe down the rails of the handles of the carts in the supermarket, because it's often on people's hands. That's why during COVID, they were talking about washing your hands, because people will touch something and then you'll touch it, and then maybe you'll touch your face, and all of a sudden that that virus is into your body. But you can also get colds during the summer as well. It can happen when you're fatigued, when you're exposed to somebody who might be traveling from a different part of the world where the virus is active, and you sit next to them, or you go out to dinner, or you're in a movie theater where they just sat, so that virus is left for you to pick up. So the best way to protect against it is to wash your hands. And be careful about when you put your hands to your face.
Can we talk again about the?
Let me just add to this. Can I add one little thing to it? The thing with a cold is that the reality is that it is not a defined entity.
Yeah.
It's when people refer to a cold, we are usually talking about symptoms of something that's going on in my respiratory tract, from the nose all the way down to the lung, and it's causing me to feel congested. I might just have nasal congestion. I might have throat congestion. I might have chest congestion. Oftentimes, as Dr. Graham mentioned, it's often due to a virus, but sometimes that cold may be due to allergies or other things as well. And so when we talk about that, we're talking about a broad category of symptoms, not a disease process per se. It is due to disease, something going on in our body. But so when somebody calls me and says, "I got a cold, what should I do?" With just that information, obviously there are questions that I can ask that will help me to understand better what it is that they are having when they're describing it in the terms of a cold. But it is a broad category of symptoms, and as you know, symptoms when you get symptoms, they don't necessarily always represent the same things from one person to another one. But yes, probably the majority of the time, and And when we get when flu season is here, a lot of the colds are due to the flu virus. There are other viruses as well that can cause you to have cold symptoms, nasal congestion, and that kind of thing. But it is a broad category. That's why people would say, well, if you go to the pharmacy, there's a section there with many types of medication to treat a cold. And remember, it's not treating the cause; it's treating the symptoms of something that's happening in your upper respiratory tract. And that's why. So if you got nasal congestion, certain things will help for that. If you got a lot of phlegm in your throat, there's certain things will help in that. So this is why when somebody says to another maybe not a healthcare individual tells somebody what to get for their colds, it might work well for them because the problem that they had may be due to something different, and therefore what they're calling a cold is not necessarily the same thing that their friend has. And so when they're telling them, and the friend come back later, say, you told me to get this stuff for my cold. It didn't do anything for me. And it's a matter of treating symptoms, and that symptom may not always respond to everything with everybody, because sometimes the same symptom that occur in one individual may be due to a different etiology in another individual. Therefore, what it takes to get some relief from it, you're not going to cure it. You're going to get relief, and you're going to get some decrease in the symptomatology, which is what we're all trying to get. If we got nasal congestion, runny nose, we want to get rid of that. If we're coughing, we want to stop the cough. So it is a symptom complex that can be due to several different etiologies.
Does being in the cold cause a cold?
No, being in the cold doesn't cause the cold. I mean, let's put it like this now. There's something called vasomotor activity, and when your body is exposed to cold weather, it responds in a certain way, and sometimes it can trigger your vasomotor portion of your body, and that can produce some cold symptoms. But it doesn't cause you to, and those symptoms may or may not last a few days, or they may last, until you warm yourself up. But being in the cold doesn't usually cause you to develop these kinds of problems. It's usually something else. You're allergic, you have a viral infection, you have some irritants that are in your environment that's causing you to have these symptoms.
Well, outstanding. Linda Johnson is here, and she says good evening to everyone. Regina Rivers is here, and she says good evening to everyone. Deborah Crable is here, and she says good evening. Nellie Purnell King is here, and she says good evening. Audrey Jaycox is here, and Audrey says good evening to everyone. Mendine Mohammed is here, and he says watching and listening in Chicago. Watching and listening. So we have a question from Instagram that says, is there a cure for COPD?
So there is treatment for it, but there isn't a cure. It's a process of having an injured lung, and this is how the lung responds to the injury. We haven't developed the tools yet to help the lung repair itself so that COPD returns back to normal.
Doug, you want to say what that COPD means?
Okay, great. C stands for chronic. O is for obstructive, meaning it's hard to move air in and out. P is for pulmonary, and D is for disease. And these are people who have trapping of air in their lungs because of damage to the airway and the very small lung tissue. And as part of that damage, very often the lung will make extra mucus, so they're chronically coughing up phlegm and wheezing because of the difficulty moving air in and out of the tissues and the airways themselves. And that's why they call it obstructive, because it's hard to move the air in and out of the airways.
Now,
so the airways are kind of like tubes, like straws, different sizes and shapes.
So is that the reason they're placed on oxygen?
Most of the time when we need to use oxygen is because they are unable to take in enough oxygen because of the obstruction. So when I say obstruction, we mean that there's something, and it's usually within the airway, that's causing.
Luke, you okay?
I'll fill in for Dr. Miller, is that they can monitor how much oxygen is getting into your blood. And it may be that they need to increase the percentage of oxygen that you're inhaling so that you get a healthy amount so that all of the organs function normally. They wouldn't issue that to you if there wasn't a problem of not getting enough oxygen into the blood.
Yeah, and the other thing, the question I had that I was raising about the cold causing a cold, one of the things, because we batter that around a lot, and it's very misinforming sometimes. But what I want to make it clear is that being in cold doesn't create the cold. The cold is created by the virus that Doug and Dr. Doug and Dr. Miller talked about. But one thing that does happen with the cold is that we tend to sometimes be closer to people when it's cold outside. And because we're moving along, or we're coughing and we're not covering because it's cold, we're cold outside, or there's some other things that are happening. We're trying to move quicker. And so there's a lot of things, but I just wanted to make sure that we made that distinction, that the cold itself, that the thing that we call a cold is really, as the doctors have already explained, it's a response to viruses or what have you that are causing problems in your airways. But there's, to my knowledge, just because you're outside. Now, if you're outside and you're closer to people that are coughing and things of that nature, yes. Or if you're on the bus and you're coughing and you're sneezing. But that can happen even when it's not cold outside, if people are having those symptoms and you are nearby them and you're inhaling some of these virus particles right in the presence of the cold, the people themselves. I'm sorry, go ahead.
Well, we got Dr. Miller back, so go right ahead.
I don't know what happened there.
It's okay. Technology happened.
Yeah. And I was just giving a pause. I said, oh, it was a little too long. So
when the oxygen level in your blood decreases below a certain level, then bad things tend to happen. Lungs are the organism that is the organism that we can bring in oxygen and dissipate, release ourselves of carbon monoxide. And when the lung doesn't work properly, we can get a shortage of oxygen and too much carbon dioxide. And those is the opposite way that we should be going. But the need for oxygen is when our breathing is not adequate to keep up with a minimum level of oxygenation. Then bad things start to happen to other system in our heart, blood pressure begin to have issues, and those are the issues that while we oxygenate a person, give them oxygen so that it helps to alleviate this problem. So even though they may have, it doesn't get rid of the problem that's causing it by having the extra oxygen on board or exposed to the extra oxygen, then they can better compensate.
Okay, question from Facebook, and the question says, can sleep apnea cause upper respiratory and or breathing problems? Sleep apnea.
Yes. Sleep apnea is can often cause, it's associated with a problem with pulmonary hypertension. It can also be related to systemic hypertension, the high blood pressure that we normally can talk about. But sleep apnea as well can create problems with pulmonary hypertension, as well as it can create problems with your heart. So that combination of heart disease and and pulmonary hypertension are the things that can occur with sleep apnea.
And I think, the things that you're bringing home is that there's a lot of things that we need to do. And we need to understand that when we're in that season, when people are coughing and sneezing and things of that nature, make sure that at least you're covering your cough. Make sure that you're doing the things that you can cover your sneeze, because that's how these viruses are then put out into the atmosphere. And it doesn't matter whether it's summer or winter. You can get these problems. And as you have these things that create inflammation, if you happen to have underlying other conditions, and my colleagues will talk about that more, particularly like asthma, these things can be really problematic. And if you smoke, you are now just adding even more fuel to the fire. And there's nothing good about smoking cigarettes at all. And we definitely need to make certain, whether they're cigarettes, cigars, or things of that nature, around people, these things are creating damage to those lung cells that Doug and Dr. were talking about a little while ago. So I just want to underscore that.
Yeah, I think that it's important for people to recognize that you may have normal lungs, and but if you're really a heavy cigarette smoker and you've been doing that for a period of time, you probably do not have normal lungs, but you might not have any symptoms at this point. But whenever you create a environment that's filled with something other than oxygen for people who have asthma or for people that have COPD, you're causing them a hardship. They already have difficulties, and anything that's in that environment that occupies part of their lung, which has a dysfunction, that's going to become more of a hardship for them to be able to do normal things that we need to have. Everybody got to breathe, or if you don't breathe, then you can't live. And so it is so important that we recognize that when we're around other people, that we wish that everybody stopped smoking, but if you are having trouble or you decide that you don't want to, have enough respect for other people who may have conditions that the smoking can create a real hardship for their just being able to do a normal function in life. So step away from them, or don't try not to do that, especially in crowds where you don't know what kind of condition that may exist.
Well, that's certainly true. And that's certainly something that we need to, and we got to remember, this isn't just limited to adults. These viruses can be transmitted by children, young adults, a number of people all around. So we just need to always be in our P's and Q's when we see people sneezing, coughing, things of that nature. There could be some problems, and you want to be certain that you do your best not to be, when somebody sneezed or have coughed and you're in that plume that comes out, you don't want to be where some of those particles are in the air because you just sneezed or coughed and you happen to breathe them in. So just be very, these are the things that you can be to be your lung police for yourself.
Absolutely.
So I see that we have a question from Audrey Jaycox, and she says, what's the difference between COPD and asthma? I thought, when I think about this, I think about a bunch of grapes. In the grapes, you have the stems starting out thicker, and they get thinner and thinner and thinner, and then you have the grape at the end. Asthma is when the stem portion of the lung, the tubes that bring air into the tissues, are covered with muscles. And those muscles are very, very twitchy and sensitive, and they can go into spasm so that a large tube becomes a small tube very, very quickly. And it makes it hard to move oxygen in and out of the lungs. It makes it hard for you to breathe, and you're often coughing. COPD is more like an issue of damage to the grape portion of the bunch of grapes. It's where the tissues, the fine tissues that exchange oxygen out of the blood, are damaged, along with the very, very small tubes at the end. And so this is not a reversible condition. And it generally is at the end portions of the lung. And as a result, there's scarring, there's trapping of air, and part of the body's response is to make extra tissue and mucus. So people with COPD are often coughing things up. Most of COPD is from inhaling fumes, whether it's from tobacco or other things that are burning. Asthma is a little bit different. That's more of an inborn illness or susceptibility that one has throughout one's life, although one can develop it later in life and doesn't necessarily have to have it beginning with early childhood. But that tends to be a lifelong sensitivity. But the major difference is the spasm of those muscles that control the diameter of the air tends to be reversible. And chronic obstructive pulmonary disease is not reversible. It's a permanent scar or damage to the fine lung tissue.
Excellent, yeah.
What are some of the things we talked about that many people have probably used? We talked about cough syrups and things of that nature. What are the things that maybe some first line things people may want to go to, but maybe we should be thinking a bit differently about it?
You talk about in treating what the colds or treating what?
In terms of treating, particularly if they're smokers.
Well, I think, I think two things is that if you have asthma or you have COPD, number one, you probably need to be under the care of a physician, because many of the over-the-counter things may give you some relief for some of your upper airway symptoms, or if your nose is congested, it may provide you with some help. However, if you have a virus and the beginning of the problem starts in the upper part of your airway and moves down into the lung, and you think that I'm getting better, but until it reaches the disease part of your body, which is, if you have COPD, the lung is the disease part. So when that virus or the inflammation from that virus start to work down in the other part of your lungs, now you will begin to, will probably begin to suffer, other kinds of consequences that may be that are much more serious than you're having a nose stopped up. And so I mean, I think that most people that do have COPD probably, and if they're seeing a doctor, they have been probably given some kind of inhalant or some kind of medication that they can treat these problems with. And so it's important that that's why it's important that that's what you have. And if you're coughing and, I mean, I've heard people, patient come in because somebody, maybe a family member eventually talked them into coming to see a doctor. And, and so they'll come in and say, I've been having this cold for years. And so, so the thing is, if you got a cold, the majority of the time it will go away if it's just a cold, unless you have some other underlying disease process. So cold don't just continue for years without it going away. So if you're having a cough or going on for prolonged periods of time, then you need to see a physician, because something is going on more than just you having a cold. If you got a runny nose and it's always running, it may not be as serious as having COPD or asthma. However, you probably have a condition there, whether it's an allergy or you have some other problem that is causing some obstruction in your nose, or you have other kinds of things that are going on, and it continues. Then if you got a cold, you go and you take something, and in a couple of weeks it go away, then that's fine. But prolonged or recurrent without anything that provoking it, then you probably need to have a doctor look at you and examine you and decide whether or not this is just you having something in your environment that you need to have eliminated, because there are things in one's environment. In your house, there may be dust. There may be other kinds of things that are irritating to your airway, or there may be something in your environment that you're allergic to. And these things can also cause some symptom, like it make you feel like you have a cold, cough, nasal congestion. So you need to know what that is, because again, if you're having it and it's prolonged, that means that there's something that's not self-limiting. See, the thing about a cold tend to be self-limiting, which means that if you survive it, it doesn't kill you. It'll go away. It won't last. It'll last a certain amount of time, then it will go away, and you should be okay. But if but if it go away for a few days and then you're back doing it, you're back doing the same coughing with the same sneezing or whatever, then that means that should indicate to you that there's something a little bit that is more serious with you, and that you need to have defined and evaluated by someone who understands how to evaluate it and understand what may be going on with you and can give you some help. I mean, that's very important. And also, it's important. A lot of people will go and they'll buy things themselves over the counter, Primatine and that kind of stuff, and which is, if you know that you got asthma and you just can't get your asthma, and the Primatine is the only thing that you can get, okay, until you can get the right medication. But don't just ignore those things and then start to self-medicating when you don't really know what's going on with you. That's when people tend to get into some trouble that can be life-threatening.
The color of sputum that comes up when you cough or have something like this, what does that tell us, or does it tell us anything?
Go ahead, Dr. Miller.
Yeah, so what happens is that if the sputum is white or similar to what we call spit, then that's tend to be more just what the kinds of thing that we see if someone is just having a non-serious kind of thing. But when the sputum begins to turn, we see yellowish in the sputum. That is a significant thing that we need to look at, because you may have an infection. When we see the bloody streaks of blood in the sputum, you may have an even more serious kinds of problems, and that need to be evaluated, because some are, we look at these things and we talk about the infections and things like that, but also lung cancer or certain types of cancer within the upper airway can also cause symptoms of lung condition, can cause you to have coughing, and can cause you to have excessive sputum production, because they too can cause partial obstruction of your airway and cause you to have these symptoms. So when you cough up, you bring up anything that's not clear, then you need to have it evaluated and have yourself evaluated to see what may be going on.
These are very important things, and thank you very much, because it's important that we do everything that we can do. Now, even though we're in the colder times now, what is the difference in terms of the severity of these kinds of problems in the summer months, or when it's warmer versus when it's colder like now?
Well, I think we have to look at two things. First of all, we are in a season we call flu season, and we call it the flu season because this is the time of the year when this influenza virus tend to be more prevalent in our surrounding, which means that there's more people that has the infection. And when people have an infection and they're coughing, they tend to, that's a mode of spreading these things. So it's not just the weather, but it is the time. It is the season for these things to occur. And so when we are in this season, then we tend to get these things. And I will say this: if you happen to have the flu virus or any other virus that's affecting your upper airway, and you walk out in the cold weather, now you have to realize that you're dealing with a partially compromised upper airway system. And so in a compromised airway system, you may have more difficulty. In other words, if you got the flu and you're in cold weather, then you're going to probably experience some more symptoms than if you were in warm weather, you was inside the house as opposed to being outside. And so, I mean, you can have a cold any season. You can have a viral infection in any season, but it's more common during the flu season because the flu virus tend to be occur during this time of the year. And so when it does occur, that means that it's there in a higher concentration, and it's more likely to be passed around, and therefore these problems will be more prevalent. So, and if you have other conditions, not just the lung condition we talked about. If you have asthma, you have COPD, but even if you have heart conditions, you have diabetes. Getting an infection can exacerbate these other conditions, can make them can cause them to be a compromise in your functional status, and you don't do as well as you otherwise would do. Doug, you.
Well, outstanding. And I know you guys hate to hear me say this, but it's our time. I want to say hey to Yolanda Williams, who is here. She says good evening. And David Bolden is here just as well. We have a couple different people who are here. I cannot forget the guys that are in the basement, but AKA really in the garage. And I cannot forget our friends over at the Core Center. And the list of all of you who watch, I will not forget you next week. The conversation has just been so robust. We didn't get a chance to get to everyone. So, Doug, what is your until next Monday?
Well, I think I'm going to sound like a broken record, but I think an important thing happened this week, and that is virtually all of the state medical societies decided to follow the vaccination guidelines of the American Academy of Pediatrics and not the FDA or the federal government. And they're doing that for a very real and genuine reason. This is our best way to protect against serious illness and injury. Mm-hmm. And so that in our government now, we have a real conflict of interest between the leaders who benefit from a position and, let's say, the patients who will not benefit from a position. So I think it's if your doctor follows the American Academy of Pediatrics or the American Internal Medicine Societies, they'll be the ones to tell you which vaccinations and when. I still would encourage flu vaccines. I still would encourage COVID vaccines because COVID hasn't gone away. It just isn't in the news because there are other things that are dominating the headlines. It's still a serious illness. And the best way to protect yourself from long COVID is to get every new COVID vaccine that comes out.
Absolutely. Thank you so much. Well, Dr. Mason, you're until next Monday.
Until next Monday is we purposely made sure that we got these messages out this evening in a repetitive way so that you could hear it more than once, because we know that, we have to stay diligent and we have to be mindful of the things that are coming out of us when we cough, or coming out of us when we have bowel movements, or coming out of us when we, sneeze, blood, things of that nature. So pay attention to those things and realize that we need to eat as well as we possibly can. And we should make certain that we take advantage to any vaccines that are available for what's going on, and to avoid being around people that are having coughs, particularly coughs that are productive, where sometimes something comes out when they cough. So you just want to be sure that you take the best care of yourself and make sure you do all the things you can do to make sure that you do what is right. And lastly, we want you to stay healthy. We want you that if you're not feeling well, don't necessarily push yourself sometimes, because that's not always a good idea. So until you're feeling good, stay home. Don't bring things to other people in the workplace or even the family. So thank you so much, Congressman and Nikki, for this. And I can't thank my esteemed colleagues that were on this tonight, giving great things, Dr. Doug and Dr. Excuse me. Oh my God. Dr. Miller. So thank you so much.
Well, the body needs the rest sometime to rejuvenate. So thank you so very much, Dr. Mason. Well, Dr. Miller, you're until next Monday.
Well, I'm going to just say is that, if my car has a problem, I take it to a mechanic, and that's somebody that I can trust to to deal with the problem of my car. If my body has a problem, I'm going to go to a doctor, and that's the person that I can trust. So what I'm saying, it is important that we make certain that we have people who are trained to do what it is, that we trust people who are trained to take care of what it is that we are having a problem with. I know that we live in a complex society, and sometimes it's the politics come to play because everybody don't always agree. But I think that if it comes down to the end, you got to make a decision. Choose the person that knows about that particular problem, and let the other stuff work out. But if you're trying to decide on what I should do with my body, whether I should take a vaccine, whether I should take a certain medication, trust your doctor for that. The other stuff can be worked out, but in the meantime, always choose the person that has the experience, the training to give you the best advice.
Outstanding. Well, Audrey Jaycock says, thank you for good couch conversations as always. And Lisa Lewis is here and she says hello just as well. Hey, Lisa. Well, Congressman, as usual, take us home. Oh, you're muted. Let me see. You're muted. You got to unmute on your end.
Unmuted.
There you go.
Be unmuted. I agree with all of those who say, in God we trust, and the rest give me training and information and data. And so I stopped and picked up some stuff before I left Chicago that I will be taking in a few minutes when I get home. But really, try and stay warm. I find that as long as I stay as warm as I can during the winter, I generally don't have a problem. And if I'm careless and allow myself to go and not be protected, then that's when I get a problem. So stay as warm as you can, stay as protected as you can. Thank you all so much. And it's cold in DC right now. Thank you. Have a good night.
Good night. Until next Monday.
All right.